Hello guys, I hope you are. Today we're going through hypokalemia and what hypokalemia can lead to. So hypokalemia is reduced potassium levels as we mentioned previously, and it can cause cardiac arrhythmias or QT interval prolongation, or it can predispose to these issues. Now you can imagine if you're trying to treat a person for arrhythmia and you give them a drug, for example, like macrolides that can cause hypokalemia, will that be good? Or if you give them loop diuretics, so if you give them thiazide diuretics. So we need to be aware of these problems when we're revising, right guys? So let's just name the drugs that can cause hypokalemia. We have loop diuretics, we have thiazide diuretics, we have macrolides, we have corticosteroids, for example, and we have many other drugs that can cause that. Now, if we quickly look at some issues with loop diuretics, as loop diuretics have some stop criteria with it. And what I mean by stop criteria, I mean it's a screening tool of older persons' potentially inappropriate prescriptions. So stop criteria to aid medication reviews. So lower initial doses of diuretics may be better for elderly because of their renal function. So usually drugs that are diuretic based, you need to be careful if someone has a not so healthy renal function. For example, caution is an elderly that are using it as first line treatment for hypertension, because you may be able to give them a more effective alternative treatment, or for treatment of hypertension with concurrent urinary incontinence, so if they're not able to go to the toilet as well. So hypokalemia is dangerous in severe cardiovascular disease and in patients also being treated with cardiac glycosides. So often the use of potassium sparing diuretics should be avoids the need to take potassium supplements. So hypokalemia, which obviously is caused by loop diuretics, is dangerous in those that patients that have severe cardiovascular disease, right? And patients who are taking cardiac glycosides. Now we know cardiac glycosides, for example, is digoxin, right? So that's a very crucial point to understand. So hypokalemia in those patients who have severe cardiovascular disease and patients who are taking cardiac glycosides. Now, obviously, we know a form of a cardiac glycoside is digoxin. So digoxin is a form of cardiac glycoside. But let's understand. So, what electrolyte imbalances can make digoxin toxicity worse? Digoxin is affected heavily by hypomagnesemia, hypokalemia, and hypercalcemia. These are the issues with digoxin, and you need to be aware of that. So you can imagine when we're looking at sort of electrolyte imbalances or drugs that can cause the electrolyte imbalances, which drugs are we thinking of? So we straight away should think of PPIs. So PPIs, for example, are omeprazole, used for H. pylori eradication, right? And can cause hypomagnesemia as well as systemic lupus erythematosus. So when you're studying, look out for these names, very important. So as we said that hypokalemia in those patients who have severe cardiovascular disease and patients who are taking cardiac glycosides, you need to be careful of hypokalemia. Now, in hepatic impairment, hypokalemia caused by diuretics can precipitate encephalopathy. So if you have a patient that already is hepatically impaired and they have hypokalemia, then the hypokalemia can precipitate a patient. So diuretics can precipitate a patient to have a hepatic encephalopathy if the patient has hepatic impairment. And that is very important to understand, because a lot of people ask, why is hypokalemia such a big problem? Hypokalemia is a problem because it's bad if a patient already is elderly and has severe cardiovascular disease, and patients who are already taking cardioglycosides. And often, if we use a drug like spironolactone, which is potassium sparing diuretic, it avoids the need to take potassium supplements, because potassium sparing diuretics do not cause hypokalemia; they cause hyperkalemia. So they sort of balance it out. And thank you so much.